Okay, I'm Heather Karachi, and I'm going to do my postpartum assessment on my patient. I wash my hands, clean gloves, check the patient's ID band, and I'm going to start with doing some vital signs. I would take her, I don't really need to do it, but I would take her blood pressure, temperature, pulse, pulse on her wrist, watch for her respirations and count those. Also listen to her lungs. And on her back. Check her pain level. See how you're doing with your pain on a 1 to 10. Have you been having a lot of pain or?
Probably just a 3, nothing I can't handle.
Okay. I don't know if you're breastfeeding or not.
No, I don't plan on it.
Okay. So I don't know how, I would palpate, talk with the patient, and make sure there's no redness or hardness or extreme pain. Make sure there's no cracking or things like that if she's not breastfeeding. But if you are not going to breastfeed, if you do want to breastfeed, I'll have the lactation nurse come and talk to you. And if you've decided that you don't want to, we can do some things to help alleviate everything by using cabbage leaves. So we can.
Should I wear a tight or a loose bra?
If you do decide you're not going to breastfeed, a tight bra would help. Yep.
Okay.
And then I'm going to have her lay flat to check her uterus, her fundus. So I have 2 hands, one on her pubic, one right under her umbilicus, and just feel the firmness, if it's midline, and just check where her uterus is moving to, or decreasing. I would check her, listen to her bowel sounds, all 4 quadrants, and check if are you passing gas?
Yes.
And then when was your last bowel movement?
Today.
Today. Okay, so that's moving. That's good. As far as urinating, I don't know how often you've been going. Are you having any burning or uncomfortable, any odor or anything with your urine that you've noticed?
No, but sometimes I can't feel and I have to go.
Okay, so the best thing to do, we want to keep your bladder empty because that's going to help everything shrink back to where it should be. So just to go to the bathroom every 2 hours, whether you feel like you have to go or not. So emptying your bladder is good. Get it back to normal. As far as bleeding, lochia, have you noticed how much is on your pad? Are you soaking through, or how often have you been changing
No,
those?
it's pretty moderate. I've been doing it about every hour, every 2 hours.
That's good, every hour.
Yes.
And then as long as you're not, the rule of thumb is that you're not soaking a pad in less than an hour. And if you are, let us know right away. If you're at home and you're bleeding, it should be getting lighter now and changing colors. If you're at home or here and it goes back to red suddenly, then we want you to call us. That means you're probably overdoing it.
Okay.
You need to rest some more. So I would have the patient, also as far as passing clots when you're bleeding, some small clots are normal, but if anything would be abnormal that you think, then you could call us.
Okay.
And then I would check the patient's perineal area, see if I would utilize the Rita, that's redness, edema, ecchymosis, discharge, and approximated, and check if she has hemorrhoids, how things are healing, make sure there's no redness or infection that looks like infection. Then I'm going to have her come back and just check her calves and her feet, just check for swelling. Are you having any tenderness in your calves?
No.
Things sore? Okay.
How did my epidural site look?
It looked fine. Yeah,
Okay.
You do have a episiotomy, and everything seems to be healing up
Okay.
pretty well. So you just want to make sure you clean everything also when you're going to the bathroom to urinate. You can use the thing that squirts water, kind of keep things clean, and that will help. So make sure there's no DVT. As soon as we can get you up walking around, it's best. So whenever you feel like walking, we can do that. And if she's having cesarean, I'm gonna look at her incision. I want to note how they've closed her, if it's sutures or staples or glue. Make sure there's no drainage or redness or hot, things like that. And also I want to check her IV site, whether she's had a cesarean or not, check that. And check her Foley, if she had one, make sure that's looking okay. Meanwhile, while I'm talking to her and doing all that, I'm going to kind of check her emotional state. Crying is probably going to happen, but if I was concerned about anything else, then that would be a time for me to take note on that. Okay, I think that's it.